Thank you very much, Mr. Moderator. The title of my presentation for today is E-Cig, No Harm Done So Far. Good day, everyone. I would like to thank the Harap Group, particularly the three professors who invited me to speak about dental harm reduction. I would like to thank Professors Ron, Jay, and Sandro. I personally believe in the advocacy of the group, as my role in the Philippine Dental Association allows me to formulate oral health policies that will be beneficial to promote good oral health and thereby lessening the risk of harm to the oral health of the public in general. So let me begin with this. Cigarette smoking causes a number of serious diseases and has detrimental effects on the human health, including oral health. So in the Philippines alone, 87,000 died last year from smoking-related illnesses. And sadly, only 4% were able to successfully quit. So let me tell you about the adverse effects of cigarette smoking. First is tooth staining. There are two types of tooth stains. First is the extrinsic, wherein the outer layer of the tooth, meaning the enamel, is affected by the coffee, the cola, and the red wine that we drink. And yes, that also includes smoking. Intrinsic is more permanent and damaging, and this may be caused by overdose of tetracycline antibiotic and exposure to high dosage of fluoride, which we may get from dental products, dental toothpaste, or water. Another adverse reaction is gingivitis, and this is characterized by bleeding gums, swelling gums, and caused by the bacterial plaque and stains that accumulate in between tooth gaps. And this may lead to the destruction of the gingival tissues and periodontal ligaments. If gingivitis is not abated, it may result to periodontitis. Periodontitis is a more severe form of gingivitis, and this is again characterized by inflammation of the tissues of the mouth, recession of the gums, and loosening of the teeth. But not all gingivitis lead to periodontitis, but gingivitis usually precedes periodontal disease. Halitosis and bad breath, yan. This is the most common effects of smoking. Now, tobacco smoking is a risk factor for developing oral cancers. And oral cancer is the cancer of the lips, the mouth, or the throat. The primary cause of smoking-related diseases is the number of toxic chemicals found in cigarette smoke. There are 7,000 chemicals contained in a cigarette smoke, and 69 of which are carcinogenic. So majority of these toxic chemicals are only released when tobacco is burned. So how is tobacco burned? When the tobacco leaves combine with the sawdust, it results to combustion. The effects of smoke exposure are progressive with continued smoking, which is why the smoking-related diseases increase with time and the amount. Meaning to say, the number of cigarettes that you smoke a day and the length of time that you have been smoking are influences in the development of cancer. Smoking cessation is the discontinuation of tobacco smoking. And when a person ceases to smoke, it may result in a gradual reduction in the risk of smoking-related diseases over time. And for many smokers, can even fall to levels approaching that of a never smoker, if given time. So I would like to show you a comparison of the lungs of the same person, right? Was when he was smoking conventional cigarettes. Notice the increased density of the bronchioles, and on the left side, when he went into smoking cessation. So there is this ability of the lungs to recover given enough time. For some, smoking cessation would not actually mean quitting, but shifting to a less harmful means of smoking, one that would lessen your exposure to the toxic chemicals in smoke. As a dentist, I would always advise my patients to quit. However, with the independent studies available on smoke-free products, I am inclined to advise this at as it may be less harmful to my patient's oral health. To support this decision, let me share with you a report commissioned by the Public Health England on e-cigarettes, and it acknowledged that e-cigarettes presents an opportunity to significantly accelerate already declining smoking rates and thereby tackling one of the largest causes of death in UK today. Another study is from the Science and Technology Committee of the House of Commons in UK. And they also acknowledge that e-cigarettes are substantially less harmful by around 95% than conventional cigarettes because they eliminate the tar and carbon monoxide of conventional cigarettes. And these are the most dangerous components. So, no doubt about it, quitting is still the best. However, as a dentist, I would like to enlighten conventional cigarette smokers to the available alternatives in the market and let them choose freely. Choose freely given the right protection and information. At this point, I would like to cite a study by Amalia Ahmad Shauki, a faculty of the Department of Pathology and Oral Biology of the Universitas Padjadjaran, Indonesia. And the author of this particular study is also a dentist. And she looked at the impact of using e-cigarettes versus conventional cigarettes on the oral health of an individual. The study examined the buccal mucosa smears from e-cigarette users and compared that with the conventional cigarette smoker and looked for the presence of micronucleated cells. So what are micronucleated cells? These are damaged cells with damaged chromosomes. If you look at the slides below, there are two microscopic slides comparing that from an e-cigarette user and a conventional cigarette user. And there is a marked difference in that in the e-cigarette users, you will see cellular changes which are far lesser than those of the conventional cigarette smoker. These cellular changes are marker for cancer initiation. So I'm not saying that those e-cigarette smokers will never have any buccal mucosal cells with micronuclei. I'm just saying that they have far lesser than those of the conventional cigarette smokers. And these findings indicate the safe use of electronic cigarettes or heated tobacco products on the oral mucosa of a patient. So in summary, studies like this make a big impact on how I, as a dentist, would be able to make recommendations to help my patients lead lives with less harm. So, in summary, the evidence available to date on the impact of smoke-free products on oral health suggests that switching completely to smoke-free products has the potential to reduce the adverse effects on the oral health of a smoker in comparison to those who would otherwise continue smoking conventional combustible cigarettes. So based on the studies available at hand, I can consider as a dentist recommending to my patients the use of e-cigarettes, and I may consider this as a harm reduction alternative to conventional cigarettes. To date, there are no reported cases of periodontal diseases developed while using HTPs and electronic cigarettes. At the end of the day, the best recommendation is still to quit smoking. But let's face it, patients has free will to choose whatever they want to do. So if I may advise, if you really cannot quit, at least shift to a less harmful alternative. Thank you very much. Good day, everyone.